Hello everyone, and thanks for joining us for today's webinar on addressing substance use in the workplace, policy and practice implications. I'm pleased to introduce our two speakers today, but before we do that, I'll just introduce myself. I'm Sandra Coppert, Manager of Prevention and Promotion, Workplace Initiatives at the Mental Health Commission, and I will be hosting the webinar, introducing the speakers, and time permitting, we'll do some Q&A at the end. So before I hand it over to the speakers, I just want to talk about a few housekeeping items to use before the software, to be using for the software. Sorry about that. Audio is provided in broadcast mode through your computer speakers. You can hear us, but we can't hear you. If you have any questions or comments, please type and submit them through the Q&A chat box on the bottom right of your screen. Note that we will hold most of the questions till the end of the presentation. This webinar is also being recorded. The recording and presentation slides will be posted in the webinar archive section of our website in the coming weeks. Please note at the end of the presentation there is a resources slide with links to most of the documents referenced throughout the presentation. You can download the slide deck right now by selecting Document at the right and clicking on Download Files button. This presentation will be in English, however, the slide deck is available in English and French. So just before we get started, I also am just happy to have two of our speakers here today from the Canadian Centre on Substance Use and Addiction, CCSA. We actually have collaborated with them before over the past several years, including the development of Problematic Substance Use in the Workplace brochure, along with the Conference Board of Canada. Based on the content from that work, we've also co-presented at a few conferences over the past year or so. So it's definitely my pleasure to be connecting with them again today and to be able to introduce them more formally. So with us we have Bryce Barker, PhD, and he is a knowledge broker at CCSA, which is a nonprofit organization based here in Ottawa that provides national leadership and research to mobilize collaborative efforts to reduce the harm of alcohol and other drugs on society. He is part of a team focused on substance use affecting the workplace and is responsible for the development of knowledge mobilization products for the Substance Use in the Workplace project. Bryce is joined by Shauna Meister, MA, and a research and policy analyst with CCSA. She currently conducts research on substance use affecting the workplace and problematic use on campuses. With respect to workplace, her current research includes examining impact of substance use on the workplace, substance use policies, and safety-sensitive industries, best practices, and policies related to substance testing, as well as other related issues. So with this, I'm now very pleased to pass it to our two speakers today. Thank you.
Hello. So I'm very happy to be here. Thank you, Sandra. So we were able to join in person. I'm very happy to be here to talk about substance use in the workplace. So again, my name is Bryce Barker. I'm with my colleague Shauna Meister, and we're going to review addressing substance use in the workplace policy and practice implications. So, to the next slide. And the Canadian Centre on Substance Use and Addiction was created by Parliament to provide national leadership to address substance use and addiction in Canada. We provide guidance to decision makers on issues related to the substance use and addiction field. So you can see our vision, mission, and value proposition here. So our work is focused on advancing the latest evidence and knowledge to inform policy, practice, and programs. We promote collective impact by bringing together diverse stakeholders to address substance use and addiction. There's a few points here that I definitely want to point out. So under health, you can see substance use disorder is a disease and should be treated like other chronic diseases and health conditions. So we'll loop back to this point a number of times throughout our conversation. Also, substance use and addictions contribute to mental health conditions, family violence, and suicide. So importantly, that's part of the link for us being here today and speaking with this group. We'll also note just the number of diseases like cancer, heart disease, diabetes, HIV/AIDS that are related to substance use and addictions. So substance use is complex. It's an issue that has a variety of social impacts that affect all Canadians. For example, The cost of substance use are estimated to be over $40 billion per year in Canada. We're currently working on a project to update some of these numbers and review some of these numbers, but a very substantial impact on the Canadian public. And one thing, an important point to emphasize throughout our discussion is that recovery is attainable and sustainable for individuals. So employees of organizations are able to have successful recovery experiences. So CCSA is a national framework that identifies a number of priorities that guide our work. So this presentation falls under, in part, problematic substance use and workforce development. So the objectives today are to report on findings from a research study on Canadian workplace policies and practices, and discuss considerations for applying those findings from this research. So in a bit more detail, we'll give a bit of background and context, as well as going through the research study itself. My colleague Shauna will review that, so the methodology, including the environmental scan, national survey, key informant interviews. And then I'll review some steps, some action steps you can take in developing and refining policy. So again, really focusing on that development, implementation, as well as the review and evaluation process. So an important consideration around substance use in the workplace is just the impact. So the impact can look different for different individuals and can look different in different roles. So the first 2 points we'll take together. So absenteeism and presenteeism, as well as cognitive impairments. So again, if a person is using substances in a way that they are not able to attend work, then that obviously has an effect. But there can also be the case where people are using substances in a way where they are present at work, but they are not able to perform in the way that they would otherwise. So again, their performance is impaired, and they might be working extra hours as a result. As we mentioned in the formal slide, so chronic diseases. So importantly, there are a number of chronic diseases that are linked to substance use and chronic substance use. So these chronic diseases can take someone out of their role in the workplace and can also affect them and their families and how they engage in work and are able to be productive in work. So finally, injuries and accidents and fatalities. So this might be a more remote possibility in some settings like office or office work. However, injuries, accidents, and fatalities might be more prescient, more top of mind when you're thinking about settings like transportation, safety-sensitive industries, or different roles that interact more clearly with the public. As Shauna will go a little bit more into detail about that when talking about the research study. So there are a number of workplace risk factors that come into play and that are very important to consider when talking about substance use in the workplace. So some of these will have to do with the person themselves and their own perceptions. So low job satisfaction, for instance, a lack of opportunity for promotion, their abilities to, they may feel isolated or fatigued. It might have more to do with the actual work setting. So it could be shift work, high stress environment. There could be long hours associated with the job. There could be an actual objective negative work environment. But then also importantly, there's another aspect of access to alcohol and drugs, and then meeting with clients involving alcohol. So that can be an important factor in some industries, especially like hospitality, or in some industries where it's expected that you meet with clients in a more social setting that do involve alcohol.
Thank you, Bryce, and good afternoon, everyone. This is Shauna speaking now. So as Bryce mentioned, there are definitely a lot of risk factors in the workplace related to substance use and overall mental health issues. However, there are lots of opportunities. The workplace can be an ideal place to address substance use because most Canadians spend the majority of their time in the work. CCSA, we receive numerous questions from employers regularly about this issue, And so just for instance, in 2016, we, in collaboration with the Mental Health Commission and the Conference Board of Canada, CCSA conducted a meeting with stakeholders from various industries. Our purpose during that meeting was to gain a better understanding of their needs and their experiences and how to apply that in future projects. Earlier this year, we also conducted an industry poll with some of our stakeholders. And again, that was more to ask them specifically, what would you like to see in a substance use policy? What kind of issues are you facing? How can we help you out in this way? In addition to stakeholder consultation, CCSA has also received numerous questions about the entire process of the legalization and regulation of cannabis. So this has been top of mind for many employers. Throughout all of these activities, we kind of keep hearing the same questions from employers. Employers want to know what other employers are doing to address substance use, so what can they learn from other people. Employers have also been telling us that they want to know how to develop and implement policies and practices. And of course, employers are looking for some more information on cannabis itself. Unfortunately, there is really not a lot of research on substance use affecting the workplace. So for us, in order to help answer some of the questions we've been hearing from employers, CCSA conducted a study on workplace policies and best practices in Canada. To conduct this study, we collected data using 3 methods: an environmental scan, a national survey, and key informant interviews. For the environmental scan, we examined approximately 800 organizations for their publicly available policies on substance use. And then from that information, we analyzed the content of their policies. Essentially, we wanted to know what Canadian employers were already doing, and we also wanted to find well-developed policies because we wanted to be able to share the best practices and lessons learned from other organizations with other employers who are asking us questions. After the environmental scan, we then conducted a national survey and key informant interviews. We did this more specifically to obtain details from employers who have actually had experience developing and implementing policies. We kind of wanted to understand, we wanted to have a better understanding of the challenges that they had faced, the best practices that they had developed, and any recommendations that they could share with other employers in terms of their entire process. For these 2 methods, we specifically targeted 6 select safety-sensitive industries. And the reason for this is just because safety-sensitive industries, just due to the nature of their type of work, they were more likely to have well-developed and comprehensive policies, and they were also more likely to have gone through a legal process. So their policies were more likely to be refined and well-developed. For the benefit of those who may not be familiar with safety-sensitive industries, these are businesses where, and Bryce touched on this earlier, but where impaired employee performance, it could result in a significant incident affecting the health and safety of the employee, other employees, or the public. So some examples of employees in this industry include airline pilots, or potentially bus drivers, or a forklift operator, or the construction industry. I'm just going to pull up all of these at once and just talk to them together. Okay, so in order for CCSA to examine substance use policies and also for us to be able to provide recommendations on how to develop them, we wanted to find out what actually makes an effective policy. So we turned to the literature for this. So I think most people here are aware that good workplace policies are important because they describe a clear set of rules, expectations, and principles to guide employee and employer activities. So essentially, policies help ensure that operations are consistent, that rules are being fairly applied, and they help in the decision-making. So when a manager or employee is faced with an issue, they have some guidelines in which to follow. So as I previously mentioned, although research in the area of substance use policies is still developing, the most effective policies based on what we found, appear to be those which are comprehensive, clear, and well-informed. So generally speaking, substance use policies should address the 8 items that I've put up on the screen here. So an effective policy will include objectives and scope. They will include something to address prevention. Policies will also describe how to observe and investigate for any potential substance use issues. They will provide procedures on support, procedures for returning to work, and procedures for noncompliance. Effective policies and programs will also, employers will also undertake a review and evaluation of them. And finally, all policies should meet Canadian legal requirements. So these are broad areas, and within them there are also a number of specific elements that businesses can use to tailor these policies to their own needs. So for instance, under objectives and scope, businesses will typically include, or policies will typically include, roles and responsibilities. Under prevention and effective policy, we will usually address education and training for employees and management. So what we did is we took these 8 components and we used them to analyze policies from the scan. And then we also used these components to guide our survey and interview questions. So to give you an idea of the characteristics of the data we collected, among the approximately 800 organizations that we reviewed for the scan, we were only able to identify 35 policies, 11 policy statements, and 22 position statements. So just to clarify, policy and position statements, they're not actually policies. These are cases where businesses had written some wording about workplace substance use, but they were either too brief or the statement was just simply the company's position on substance use. Among the 35 policies that we did find, 15 of them were categorized as comprehensive. And almost all of these policies that were considered comprehensive were found in large, well-established, safety-sensitive organizations. In terms of the national survey, we emailed approximately 730 company representatives, and 87 participants completed the survey. For the interviews, 49 people were contacted, and we conducted 12 interviews. For the characteristics of this data, the survey and the interviews, the majority of the organizations were from the private sector. They did range from small to large-sized organizations, and they also included unionized and contract staff. So overall, there was a fairly good mixture of the safety-sensitive industries in both of these methods. So on to the findings. There are a number of findings from this study, and the full report should be available next month in October. Here I've just listed some highlights from the environmental scan, and I'll only just touch on a couple of them. Probably one of the biggest findings we had was that there was an overall lack of policies on substance use, particularly among the non-safety sensitive industries, which include things like offices, retail, or restaurants. Now, we recognize that it's likely that a lot of corporations don't post their policies publicly online, so we were limited in being able to review all of those. However, to only find 35 policies among 800 organizations still demonstrates a potential concern. It is likely that a lot of businesses do not have policies on substance use. Another finding that we found was that very few policies indicated that they underwent some sort of review or evaluation. The issue here is that if policies are not reviewed for impact and effectiveness, then there really is no meaningful way to tell if they are truly helping the business or helping the employees. We did actually have some encouraging findings. One of the things we found was that approximately half of the 35 policies acknowledged substance use as a disability, so that was great to see. And we also found a number of policies addressed accommodation in some way within their wording. So this just tells us that companies are moving forward, that businesses are recognizing the importance of supporting the employee as well. After conducting the environmental scan, we did do a survey, as I mentioned, and this was in order to get some further details from actual employers and employees. The survey helped with providing additional information. So as I mentioned earlier, it's just important to remember that the results you're seeing on the screen represent safety-sensitive industries and cannot be generalized to all workplaces, but they do provide a good starting point. Just to explain what you are looking at here, we asked respondents to tell us what aspects were included in their substance use policies. So if you're looking at the blue line indicates yes, this particular item, such as alcohol and illegal drugs, was included in their policy. If you're looking at the green line, or pardon me, the yellow line, this indicates that no, this wasn't in their policy, it's not addressed. And the green line is respondents who were unsure if this item was addressed in their policy. So here you can see that almost all safety-sensitive industries address both alcohol and illegal drugs. Slightly fewer, about 85%, address prescriptions, and it goes down from there, so termination procedures, noncompliance. The least addressed items that were found in people's policies were accommodation and medical cannabis, and those were both under 50%. When looking at these results, really the one thing I would like to highlight is the difference between the inclusion of support measures and the inclusion of punitive measures. So the black line here represents about the 50% line. And you can see that only about 50% of policies included support measures, such as treatment, such as return to work, such as accommodation. If you look above these items, you can see that nearly 80% of policies included punitive measures, such as procedures for termination and noncompliance. So one of the things this might be telling us is that it appears that there might be an imbalance in people's policies or in corporations' policies between supporting employees and punishing them. Another question employers have been asking us is, so how do other organizations handle employees who they suspect of being affected by a substance while at work? So when we say this, we are talking about suspicion only. So this is something you're observing in another employee, such as behavioral changes, or maybe an incident occurs that makes you question whether or not that person is impaired. Encouragingly, as you can see on the screen, the majority of survey respondents and most of the interviewees stated that their business conducted some form of an investigation first. So usually the first response was the employee was referred to a substance abuse professional, a medical professional, or an employee assistance program. It was nice to see that very few respondents, only about 4%, stated that the employee was terminated or given leave. There were a number of other findings, which again you can find in the upcoming report. So for this slide, I'm just going to touch on a couple of the ones that stood out for us. One thing that was really great to see, it was good to see that about 80% of safety-sensitive employers conduct some form of education with their employees on substance use and workplace policies. So that's a good indication of communicating employers' objectives. Another finding that we had was that when substance use has been confirmed, so in contrast to the suspicion that I was talking about in the previous slide, only about half of all businesses, 56%, refer employees to some type of support program, such as an EAP. And so this again just coincides with the fact that we're seeing about 50% of policies include some sort of support measures for employees. Skipping down to the bottom, from the interviews, there were two really important insights that we gained. First, employers told us that employee commitment to recovery was critical to the success of reducing substance use. I think that's probably self-evident, but it was great to hear that employers are recognizing it. Connected to this, the second thing that we heard from employers is that workplace culture, it's necessary that it demonstrates impairment is not acceptable, but it's also important that workplace culture does not stigmatize substance use and mental health issues. So essentially, employers were emphasizing that there needs to be a recognition of substance use as a disability, and there also needs to be support measures in those policies. There were a few limitations of the study, and I've touched on them a couple of times during this discussion. One of the ones is that we only had access to publicly available policies, so there are probably a lot of policies out there that are really well done, and it could give us more information, and that's something that maybe moving forward we'll have better opportunities to look at. Another thing we did is we intentionally focused on safety-sensitive sectors, in large part, as I said before, because these were the most likely to have good policies. But what this means is that the survey results and the interviews they do not represent the non-safety sectors, and they may have unique issues that we weren't able to address in our report. So given all of these results and the numerous pieces of information that we collected, what are the implications for employers? First of all, the one thing is that without a policy, employers are really open to more risk. It's really important that businesses need to be proactive and develop both substance use and mental health policies in order to reduce risks for them and for the employees. Another aspect is that limited focus on employee well-being could contribute to ongoing issues. So ensure that policies are comprehensive, make sure that they're fair, and it's important to make sure that they balance both punitive and supportive measures. This has come up a couple times. Workplace culture, it may cause some challenges if it isn't geared towards the right objectives. So here, employers can create a culture of openness and understanding. And here you want to encourage employees to be coming forward and discussing their issues before they become a risk at the workplace. But the workplace culture also needs to be one that discourages substance use and impairment while at work. Finally, policies and practices and programs, they need to balance both employer and employee needs. There are a number of ways that this can be done. One of them is, first of all, investing in education. This is a good preventative measure. Make sure policies adhere to human rights legislation, and it's important to consult with various stakeholders. So unions should be involved, contract employees should be involved, part-time employees, medical professionals, lawyers, human resources. There's a wide range of people who could be affected by the policies. And by consulting everyone, it's likely to make the policy more well-rounded and also to encourage greater buy-in. So that's essentially a summary of the report. I'm now going to hand things back over to Bryce. He is going to talk about ways in which employers can mitigate some of these potential issues. Bryce.
Thank you so much, Shauna. So what we'll review are really just the opportunity, some benefits, and really talk about a tailored approach. So you'll see that come up in a number of slides. Really a tailored approach to your workplace and to what happens within your workplace is one of the most important takeaway elements we want you to take away from this conversation. So there's no easy answer to any specific situation, and those will often be dependent on medical, legal, and specific consultation around specific issues. Just to review those high-level elements of a comprehensive policy. So they were objectives and scope, prevention, observation and investigation, support, return to work, noncompliance, review and evaluation, and meeting legal requirements. So again, one of the main takeaways that we're coming away with from this research is just that when you're thinking about punitive elements and supportive elements, the punitive elements seem to be more prevalent and seem to be in place and more embedded in the organizations that do have policies. And what we'll be reviewing is that opportunity to bring a well-being, a more supportive approach through your policies. And so we'll highlight those opportunities. The benefits to organizations will be better health and safety for employees, better risk management for employers, and the public, excuse me. Finally, again, we can't emphasize enough that tailored approach and how important that is throughout this conversation. So even in thinking about the composition of different organizations, it's very important to think about who is within your organization and what role they'll have within developing that comprehensive policy. So again, every organization will look slightly different. Some will have unions, some will not. Shauna mentioned there's some variability, and some that do have employee assistance programs and others that do not. Is there a union? So all of these different considerations will come into play. So again, and that together, those will make up your workplace context. So thinking about the context of your organization and that mix of different types of positions, but then the actual tailoring policy to your organization. So what are the usual processes for developing a policy? How do policies usually get implemented? Is it really loaded towards specific roles like senior leaders and HR? Are there opportunities to reach out to different stakeholders to make sure that there is that buy-in? So we'll touch on that a little bit in some of the action steps as well. So based on your context and processes, and Shauna touched on this, there's very important legal and regulatory considerations. So some stakeholders do have specific legal and regulatory considerations that they need to have in place in order to make sure that a comprehensive substance use policy is correct and will work at your organization. So finally, what are some action steps that you can take towards policy development and implementation? So the next slides, we're going to review just some guidance from a resource that we developed with Mental Health Commission of Canada and the Conference Board of Canada. Again, with some high-level guidance about what organizations can do to bring those more supportive elements into place and make them effective in your workplace. So first, what data exists within your organization that would help you to better understand the scope of the issue at your workplace? So again, we've touched a little bit on some of the potential impacts of substance use on the workplace. So absenteeism, presenteeism, there could be turnover, there could be any number of indicators that in your specific organization could be indicative of a need for a well-developed and comprehensive substance use policy. And an important consideration in the review and evaluation process, so again, something we didn't see in a lot of policies, would be how are you going to see any movement on those indicators? Would there be any movement on those indicators that would indicate that you successfully implemented a policy, successfully developed the right policy for your organization? So Shauna touched on this, and we've heard this from different stakeholders, that if the policy or specific elements of the substance use policy are not acceptable to employees and unions, then they won't engage in the issue, and they won't believe and buy in to that approach that your organization is taking. We have seen some examples where an overall process, a more holistic process, has that workplace buy-in really centered around health and safety, and there is that commitment from employees and unions that comes as a result. So raising awareness, so make information about problematic substance use available and accessible, provide prevention and resilience building programs. So Shauna mentioned one of the main opportunities would be that preventive education, really trying to work to take this issue out of the background, out of the shadows, and make it an open conversation. We'll touch on that a little bit in a few other potential action steps. So making sure that this is a part of your workplace culture, that these issues are discussed, that you feel free and open to discuss these with other employees, with supervisors, with potentially senior leaders within your organization. So reducing stigma and discrimination is, again, these are all crucial points, but without reducing stigma and discrimination, you will have an environment where employees will not take advantage of supportive elements that are implemented in your policies. So again, if you don't have those elements well developed and there's not clear buy-in from across the organization, if I suspect that I'll be discriminated for stepping forward and talking about a substance use issue or a substance use disorder, then I'm less likely to take advantage of those opportunities within the workplace and to really prevent any potential issues from impacting my work. So leadership commitment, so communicating about available supports. So leadership should be visible and sustained. So again, throughout the policy development, the implementation, and the review and evaluation process, there are opportunities for leadership to be very visible, to be very engaged in this conversation, to be very open in this conversation. And that can help lead that workplace culture that Shauna touched on. That can help employees understand that in this workplace, there's an overall culture where we talk about these issues. The leadership in my organization values that these issues are addressed effectively, and there's an overall commitment. So that clear and sustained message from leadership on a topic are a very valuable demonstration of that open discussion and proactively addressing the issue. So this really reiterates a few points that have been made a number of times, but in organizations where you can successfully address this issue, having that balance that Shauna talked about for health and safety being the central commitment. So making sure that that culture and commitment is so clear that the organization, from employees to supervisors and senior leaders, all agree that the punitive enforcement measures, along with those support measures as an overall package, are important and valuable and are helping to keep everyone healthy and safe in your work environment. So finally, this is a more narrow point around providing information on where to get support and services. So employee assistance programs, employee and family assistance programs. However, so encouraging early treatment and support really sums up the opportunity within the workplace. So again, to minimize the impacts on the workplace, if you can help your employees to seek that early treatment and support, you'll realize those potential benefits to employees, employers, and society at large. They come through that ability to successfully address substance use and substance use disorders through a coherent set of supports, organized through policy, and then applied in the workplace. So again, we've been highlighting a few resources. One that was developed in collaboration with the Mental Health Commission of Canada and the Conference Board of Canada, Start the Conversation, and it features these high-level action steps that we've reviewed today. We also discussed briefly some other resources that are available in the field. So one being problematic substance use in the Canadian workplace, available from the Conference Board of Canada. There are a few other resources we definitely want to highlight. The Atlantic Canada Council on Addiction Step-by-Step Guide is a very useful resource in this respect. It was built in a Canadian context and built with Canadian employers in mind. The Canadian Centre for Occupational Health and Safety also has a number of resources that I think we'll touch on a little bit in some of the questions, but also has some resources in this area that are very valuable and again tailored to Canada. So there are some international resources that are available. It might be useful for understanding the background or having a reference point, but these are really specific Canadian resources. And so I'll hand it over to Sean.
For those of you who might be interested, we are having our second, we have every 2 years, the Issues of Substance Conference. This year it's being held in Calgary in November 13th to 15th. If you're in the area or if you'd like to attend, there will be a panel on workplace specifically. In that panel, Bryce and I will again talk about some of our findings, but there are 2 other panelists. A second one will be talking about cannabis in the workplace. So we do know that there's a lot of questions around cannabis and how to handle it. So we do have one panelist who will be specifically speaking to that. And then for our third panelist, we also have an industry representative. And and they have a policy in place that they probably implemented about 20 years ago. So he's going to be able to speak to how they implemented a substance use policy, some of the challenges they faced, and the recommendations and some good pieces of advice for other employers. So we highly recommend that if you are in the area or if you can attend the conference in Calgary, there will be a panel on workplace policies. Thank you.
Great. Thank you so much, Bryce and Shauna. So much great work coming out of the CPSA and specifically within workplace, so it's so great to hear all of that as well as the work that we've collaborated on together. So just a few questions with the time that we have left. Some specifically, Shauna, I guess I'll start with you in terms of the report that you were mentioning. If you have any more details in terms of when you think it will be released and then how folks can go about accessing it at that point.
All right, so the report it's just currently in its final stages of review, and we're anticipating it'll be released next month in October. You'll be able to find it on our website, but again, you can also email myself or Bryce, and we can pass on the report to you when it's ready as well. So maybe at some point we'll provide email details.
Yes, and I think actually within the slide deck of this webinar as well, there's details for both contacting Shauna and Bryce. So also related to that, were any of the 15 comprehensive policies from a healthcare system, such as a hospital?
There was one comprehensive policy from a healthcare system, actually, and we didn't mention this in the presentation, but we found in our research that a lot of the healthcare practitioners in these healthcare settings are starting to call their organizations risk sensitive as opposed to safety sensitive, where impairment by potentially a health professional such as a doctor or a nurse could have implications for the patients that they treat. And yeah, as we did come across one policy that covered this area, which was good to see.
Okay, great, thank you. Now Bryce, or it could be Bryce and Shauna, but we'll turn it over to Bryce for a moment. So this is a specific question from a participant. Do you have any comments on the challenging task that employers have to define impairment, as this definition would be a pivotal point in policies that would presumably trigger various employer decisions and actions?
And I'll speak to that very briefly, but I'll hand it over to Shauna as well. I think what we've seen from different organizations and speaking to people about the correct processes, impairment needs to be determined by substance use professionals or doctors. There need to be specific processes in place for understanding how your organization will properly assess impairment. There is some high-level guidance that is available from Canadian Centre for Occupational Health and Safety. They just released a resource regarding cannabis specifically, but it's, again, part of that, we had tailoring a number of times about those slides. This is one aspect that I would definitely say you need to be clear about what that means in your context and how would that be determined in a clear and consistent way in your context. And I'll hand it over to Shauna for a few more comments.
So this is a question we receive often, is how do you tell, how do you observe for impairment? If you're talking about right in the workplace context, some industries have actually made policies, and we saw these policies that actually put in observation criteria. They'll have maybe 10 pieces of criteria that tell them if you see these incidents, if you see these types of behavior, it's possible the employee is impaired. The procedure usually is to pull that employee out of the situation that they're in, especially if it's in a safety-sensitive area, and then talk with them separately to do further determination about whether or not impairment is suspected. The key thing here to remember is that no time are employers themselves qualified to assess whether or not somebody has a substance use issue. The idea here is just to pull somebody out of the situation if they suspect it. So there are observational indicators out there, and one of probably the best recommendation we can say for employers is talk with a medical professional who has a specialization in addiction medicine, and they can work with you to come up with some observational indicators or other indicators that and a procedure on how to handle that employee and what to do in those situations.
Okay, thank you. We do have a lot of questions that we're fielding through right now, so I do apologize in advance that we won't be able to address all of them, but we do have time for a few more. One here is related to return to work and the duration of drug testing. Is there any sort of rules of thumb, best practices in terms of how long to have the drug testing for an employee once they return?
So the recovery process for everyone is different. And when it comes to return to work, we found most companies, they will sit down with the employee, with a medical professional or a substance abuse professional, and they will work out together as a joint team what that return to work process will be. Often this might fall under a relapse agreement or a return to work agreement. In general, probably the average we've seen is these relapse agreements seems to be up to 24 months, so 2 years, where there is some type of observation and monitoring going on. But again, Bryce has emphasized this, I'll emphasize this, everything does need to be tailored specific to the organization. And when we're talking about recovery, recovery is very different from one individual to the next. And that's where these individual programs come into place. So you can expect to see relapses, but again, every individual is different.
Great, thank you. So there's quite a few related questions on the cannabis legalization, some sort of related to the zero tolerance use in workplaces, or even just more generally, any new workplace policies related to this. So can you kind of just speak to it as far as you sort of can on this topic?
So I think, one of the main points that we would want to emphasize is just having a well-developed, well-considered policy that you then take the time to implement and review. So having that overall policy, including cannabis, there might be some unique considerations as it becomes legal. But again, that's part of those specific tailoring to your organization and specifically seeking out the information as it emerges regarding impairment or regarding medical use. But in general, definitely the main message is that if you have a comprehensive, well-developed policy, it will be able to handle cannabis use and medical cannabis use, because you'll have tailored it to your workplace, your organization, and sought out the expert guidance that you would need to tailor to your organization. I'll hand it over to Shauna as well.
Okay, so yeah, as Bryce said, you do have to look at your individual situation, your individual business. When cannabis does become legalized and regulated, it'll be treated, the medical portion will be treated probably most likely like a medical prescription, and the recreational use will be treated differently. In these particular cases, we really highly recommend that you consult with legal experts in terms of how to draw up your policy. Bryce and I aren't in a position to actually offer legal advice, but generally cannabis falls under the broader umbrella of substances in general. So how would you handle alcohol? How would you handle other types of substances that are under use?
And with any existing or maybe upcoming resources, will there be any sort of policy templates that organizations can use or participants on this call today?
I think we would refer you to, and it's in the slides. So ACCA, we always use the ACCA, Addictions Council of Canada. Their resources is very well developed and really does touch on. They might break it down differently, but it touches on each of the comprehensive policy elements that we've talked about today, and it does offer that sort of concrete guidance. Again, there are other international reference points, but I would say that this has been developed in a Canadian context and with considerations to Canada in mind, so a very good resource to review.
There are also some organizations, particularly safety-sensitive organizations in the construction and oil and gas industries. A lot of them actually have publicly available policies, and we did find a couple of organizations who have manuals on how to develop your policy. Now, we're not saying that you necessarily have to follow those specifically, but there are resources out there if you look at these particular organizations. You can look at their manuals and tailor something to your own needs, or you can even contact these organizations. Many of them would be probably willing to help and assist in that area.
And again, taking it back to that point of tailoring and seeking out legal, medical advice, so that your policy fits your organization and does cover all the legal and regulatory considerations for your specific organization.
Wonderful, thank you. Well, I think that covers the general theme of questions that were brought forward today, and so I just want to take some time again to thank you both so much for sharing all the great work that you're doing and more to come, which is very exciting, and I think a lot of people today are interested to kind of stay tuned for more between what will be released and hopefully at the conference as well. So as everyone can see right now, we do have contact information for Shauna and Bryce should you have any follow-up questions or want to reach out to them directly. So again, thank you so much, and to the participants, thank you as well for joining such a great presentation as well as some Q&A. We hope that you enjoyed it, and that please remember that you'll receive a thank you email in the next few hours, a little bit different than the past few months where things would happen automatically. So if you can, try not to ignore those emails, and do let us know what you thought of today's session and some other feedback that definitely does help us moving forward with our work and the webinars as well. So please take some time to do that. And with that, we hope that everyone enjoys the rest of their day and they stay tuned for the next one. Thank you.
Thank you.
Thank you.